Welcome back to AMSA's third episode of podcast, where we will be talking about a lot about mental health, and also public health awareness. So, for today, we will have a very special and honorable guest, which is Mr. Dr. Suparjo Azmal. So, Doctor, do you want to tell us a little bit about yourself? What field you're interested in?
Sure. Thank you, Daniel. I'm actually a medical lecturer and also a pathologist. Currently working in University of Science Malaysia and doing various works on diagnostic and also some academic teaching as well. So basically, I'm still a practicing pathologist and also a medical lecturer who teach undergraduates and also postgraduate students.
Okay, I see. So, Doctor, do you know why we're here today?
Yeah, I think you have briefed me a little bit. We're going to talk on something.
Yeah. So for this month, actually, on the 24th, which is basically tomorrow, is the World Tuberculosis Day, which is on 24th of March. And actually, fun facts about this date is that on 1882, it was actually the discovery of the bacteria that causes tuberculosis, which is Mycobacterium tuberculosis. So this is a very important that because we know that how tuberculosis actually affected the world, the world population over years and centuries. And this actually, the World Tuberculosis Day was actually being founded a century after Mycobacterium tuberculosis being founded. So, Doctor, I want to ask about tuberculosis. So, what is tuberculosis?
Okay, tuberculosis is basically any kind of infections which is caused by the Mycobacterium tuberculosis, and it could be in almost anywhere in the body, but particularly in the lungs, because it's the main organ that easier to be affected or infected, and it can also be at any type of organs. Yeah. And for the Malaysian figure, usually the prevalence is around 24,220 reported cases. These 2015 figures. The latest is not out yet. And to come to a prevalence, it's around 79.4 infection per 100,000 populations. So that's a lot of cases of tuberculosis in Malaysia.
So, how often is this case actually like? Did you ever seen a patient with tuberculosis? How often is it to see a patient with tuberculosis?
Yes, it's almost how do you say? It's almost we do see regular cases of tuberculosis, like be lungs or pulmonary tuberculosis or spine tuberculosis. So we do see cases from times to times. I don't have the exact figures because it varies between centers to centers. But during my practice as a medical officer, once in Terengganu, we have a weekly clinics for tuberculosis, and during that clinics, there will be around 20 to 30 patients who are receiving our treatments for tuberculosis during each TCA or each follow-ups in our clinics.
I see. That's actually quite a huge number, and I didn't expect it to be that much because we have vaccines for it, right? So before we talk a little more on that, I would like to ask about since tuberculosis is like a bacteria and then they do spread, how do they usually spread from humans to humans?
Okay, basically it is an airborne type of infection where it spread through the aerosolized infected aerosols coming from an infected persons. Usually when this infected or affected person had cough and producing this aerosol, so it can be inhaled by other person or other humans, and this is the way of the transmission, the mode of transmission for tuberculosis. So in compared to COVID nowadays, the TB is actually more virulent or more easier to being contracted compared to COVID. So because COVID travels through air droplet, which can travel around 1.1 to 1.5 meter, whereas the aerosol, it can travels further, more than 1.5 meters.
Oh, I see. So
Okay.
that's mean that people who actually have active TB would be the one who actually transmit tuberculosis, right? So does
Correct.
yeah, so does active TB and latent TB, what differentiate them?
Okay, for the active TB means the disease is in active phase, so patient will usually presented with all of the signs and symptoms actively, means there will be some loss of weight, loss of appetite, and if it affect the lungs, the patient can present it with cough, non-productive cough, and also sometimes hemoptysis. Whereas the latent phase TB is a stage where the TB become dormant or less active, but the tuberculosis or the Mycobacterium tuberculosis bacteria still contains within the lymph nodes and also the tissue of the within the human body. So at this time, it is called a latent phase TB, where it usually this person or this patient who had a latent phase TB usually does not express any kind of sign or symptoms. So you won't find any significant sign or symptoms of tuberculosis infection during this time. And usually they are not capable to infect from two other person the mycobacteriums.
Oh, I see. So what is the possibility of latent TB becoming active TB? How long usually, like if I'm not mistaken with the term, like is it like a period where it becomes from latent to active? How long was it usually?
So it depends from person to person because from a latent TB to become active again, it needs a few more steps. Means the host or the humans the immune system should become depleted or become weak. For example, in patient with diabetes mellitus or patient who had been infected with HIV. So in this patient, their immune system is become weakened. So during this time, the dormant Mycobacterium tuberculosis that are contained within the tissue and also the lymph nodes of this patient will become active again. So at this time, at this time where it changed from the latent phase TB into an active phase TB. So but the time from latent to become active again varies on person to person because it needs the immune system to become weakened first in order to become active again.
Oh, so from my understanding is that if a person who is more compromised, they would have like higher tendency to for the latent TB to become active TB, is it?
Yes, correct.
Okay. So because just now you actually talk about the symptom of tuberculosis, and I was wondering if tuberculosis, for example, like COVID-19, it is kind of hard for people to know they have or not have because the symptoms are almost the same as flu. So I was wondering what is usually the stage that people are in that would actually, give them a warning signs that they actually have tuberculosis and get it tested.
Okay. In compared to COVID usually presented in the phase of the COVID infection is very a bit shorter compared to the tuberculosis because COVID usually will become worsen if it is going to become worsen in a few days after infection. But for tuberculosis, it can last for quite some times. Usually, if a patient or person who had been infected by TB and had a prolonged non-productive cough, for example, more than 2 weeks cough, so they need to have a check. And apart from prolonged dry or non-productive cough, he or she also need to manifest. There are other symptoms that can point towards tuberculosis, which is the high-grade fever, and also night sweat, and also loss of appetite, and also loss of weight. So these are the major symptoms to suggest that this patient or this person having TB. And apart from that, he or she also need to become in contact or had a history of contact with any patient who are or person who are having prolonged cough or well-known TB cases. So that is a point or sign and symptom that might alarm someone that they might be having a pulmonary tuberculosis.
So, would you say that most people actually come and seeking, medical help, they actually didn't know or didn't suspect they have tuberculosis until they actually get tested?
Yes, correct. Usually, they can present. Usually, what tuberculosis infected patient or person presented is just a mild cough at early stage. So at this time, usually the doctors will give various type of antibiotics, and usually antibiotics won't help in reducing the cough because the mycobacterium is a very tough, a very strong kind of bacteria which can withstand almost regular kind of antibiotics. So usually they will keep on coming few times to the clinics until it become from it is changed from acute phase of cough until it become a chronic cough, which is more than 2 weeks. So at this time, usually the doctors will suspect that this patient might be having tuberculosis.
I see. So it's already it's actually a very serious disease, and it's very virulent, as you said it before. So
Yeah.
most of the time people come in not knowing they have tuberculosis. So what if like they didn't know they have tuberculosis and they ended up going around and spreading it? And what's like if we actually found out a patient have tuberculosis, what do usually doctors do?
Okay. In the patient who had presented with this kind of symptoms or signs, usually the doctors will suspect of when a doctor suspect that this patient, his patient or her patient is having most probably having a tuberculosis. So what the doctors usually do is to order a few investigation or put this patient for some investigation. The most common investigation to do is the sputum for acid fast bacilli and sputum for tuberculosis culture and sensitivity. Apart from that, there are also MANTU or tuberculin tests where they inject deactivated mycobacterium just at the subcutaneous tissue to detect the reaction of it. And the last one is usually the common thing to do is the chest radiograph. So all of these tests would help the doctors to make decision either that this patient is having tuberculosis or not. So what the patient should do, even though at the level of early suspected to become tuberculosis, so what the patient should do is to reduce the exposure to other and to wear a mask, like just similar as we apply in COVID infection.
Okay, I see. Um,
Yeah.
so we know that like active TB, right, always shows signs like coughing and all that because it's like one of the way of the bacteria to use us to spread the bacteria. But
Yeah.
is there any site of the body that tuberculosis would infect, like the meninges of our brain or?
Yeah, it can. Tuberculosis can affect or infect other organs as well. The most common part, usually that we as a medical practitioner noted is the infection towards the spines because during the primary TB, the TB is of course only localized at the lungs and also the lymph nodes at the perihilar region. But when it turned into the secondary or a secondary TB, so it can spread anywhere. So the most common site to be seen or become affected is the spine. And apart from that, the kidney, the liver, and also the brain also can be affected or infected by Mycobacterium tuberculosis. But it depends from person to person. It varies some, and depends on the way the bacteria being carried to these organs.
Oh, okay. Thank you for that information. So,
Okay.
so what if someone was actually, being told that they were infected with tuberculosis? So they were being told that they will have to minimize contacts with other people, and then they have to wear
Yeah.
masks. But I was wondering if, what is the side effect of what medication usually people give since antibiotic doesn't work, right, for this condition?
Okay, so the first thing to minimize the spread is to reduce the exposure. So the patient should try to isolate, and if you're working in the government or working in any sectors, usually they will give you leave because TB is highly infectious. If you go to work, they might contract or infect the other your colleagues. So usually try to isolate. And the most important thing is if you are unable to avoid going out, you need to wear a mask. And please do not spit or cough out phlegm or mucus into the opening, because this phlegm or mucus contains a lot of mycobacterium, so it can infect other during that exposure. And also the patient or person need to get the treatment and comply with the follow-ups. There are a lot of multiple drugs for anti-TB medications, but it depends on the site of infection and the types of medication. It depends on the site of infection, the type, and also the durations of medication varies from person to person. So usually treatment will use multiple anti-TB medication, for example isoniazid, rifampicin, pyrazinamide, ethambutol, and also streptomycins. And usually for pulmonary tuberculosis, optimal treatment will take around 6 months, and for extrapulmonary around 12 months. And even though this medication is good and is strong enough to kill or lift the Mycobacterium tuberculosis, but there are some complications, and the patients need to have a regular checkup. The most common complication is the renal and also liver impairment, so that each time they come for follow-ups, renal function test and also liver function test is a must in this patient to monitor the toxicity of the medications.
Previously we did talk about the how antibiotic doesn't work on people with tuberculosis, right? So we have to opt for other medication. But every time we would heard about something like the bacteria or like certain pathogen, they actually develop resistance against the drug. So does this happen with the Mycobacterium tuberculosis?
Yeah, sure. It is not inclusive to other bacteria. Mycobacterium tuberculosis also has some capabilities to become resistant. For example, in some cases where they are classified as MDR or multi-drug resistant tuberculosis. So in this type of bacteria or mycobacterium, the bacteria itself is resistant to both isoniazid and also rifampicin, but they are without resistant to other medication or other drugs. So this is the multi-drug resistant. There's also another extensive or another super variant of Mycobacterium tuberculosis, where they name it as extensively drug-resistant tuberculosis. in this type of resistance, the bacteria itself is resistant towards isoniazide and also rifampicin, and also second line of anti-TB, which is the quinolones, and also second line aminoglycosides. So they got a few other second line. This type of mycobacterium or bacteria is also resistant towards the second line of anti-TB. So that is the problem in managing this type of patient, because they need a more stronger medication or stronger antibiotics, in which produce a lot of side effects, which we didn't want that to happen. But in the same time, we try to minimize and to cure the patient out from the TB. So that's the problem with these kind of infections.
Okay, so doctor, moving to my very last question, which is something that I'm very curious about. So there is like a lot on like the COVID-19 vaccine, right? And even for tuberculosis, we have vaccines, which is the BCG vaccines. We took it like after like a few weeks after we were born, I think, if I'm not mistaken. And even though people who took that vaccine, are they still have the possibility of getting tuberculosis?
Yes, actually, any kind of vaccine does not make you 100% less 100% protected from the infection. But what vaccine does is it tries to reduce or minimize the effect of infection or the complication of infections if it is happened. So for example, like in this case for tuberculosis, we do give BCG vaccination. So but we need to understand why do we give BCG vaccination to the babies. This is because usually BCG vaccination is given in high prevalent country with high prevalence of TB cases. For example, in Malaysia also because there's a lot of migration from outside. So there's a lot of TB cases that occur in our country. So we have a high prevalence of TB cases. So that's why we give BCG to each baby. So next is to understand what does this BCG vaccine do to the baby. It actually protects the child against tuberculous meningitis and also miliary TB. So that is the thing that we try to protect the baby. But we does not protect the baby throughout the lifetime of him or her against TB. So that's why along the lifetime, the babies, when they become adults or become child, he or she still has a chance to contract tuberculosis. So BCG is not 100% protective, but it reduces the complication or the effect of the infections towards the humans.
Yeah, and we actually can really agree that the vaccine does reduce the case of tuberculosis from, we've been fighting this, fight for like centuries. Yeah. So it does definitely help, and I definitely encourage everyone to take the COVID-19 vaccine.
Yeah.
Despite what the anti-vaxxer says. So yeah. So I think these are all that I think we have covered everything, and so thank you, doctor, very much, because it's very informative. I think I learned a lot from this, and we had several sessions back then on tuberculosis, PBL, and yeah, definitely this taught me a lot. So thank you also to all the viewers. We hope that you would subscribe and also continue to share this video and to raise awareness, because tuberculosis still affects us, and there should be awareness on this. So thank you very much.
Yeah, thank you.